Hi, my name is Jennifer Thomas, or Jenny for short. I want to thank you for taking the time to review my video and application. I'm very excited to get started in a DNP program, and I very much hope that I'm a great fit for the JSU program. I will start by telling you a little bit about myself. This is very candid. I prepared as much as I possibly could, but I'm going to be 100% honest and say that I just learned of the JSU program approximately 3 days ago. I was researching different programs and thought to myself, maybe JSU has got an NP program by now. And so I went to the page and I found it, and then I knew that this was a program for me. However, the deadline for admissions packet is the 15th, and I called to see is there any way I could get an extension, and they said no, that they had actually extended it from the March 1st. And so Tammy was great and encouraged me to go ahead and try my best to get everything in, and so that's where I am right now. So like I said, this will be very candid, and just know that I have a lot of passion and I really did try to prepare. So I will start with my background as far as my education. I started at Jacksonville State when I was 18 years old. I grew up in Oxford, Alabama, graduated from Oxford High School, actually got married right out of high school, but still decided to go ahead and continue my education, and I was enrolled at JSU. Life happens as it does, and we ended up moving out of state, and I ended up putting my education on hold. Through all of life's happenings along the way, I had an experience where we lost our daughter. She was born without a heartbeat. We knew that that was going to happen just a day before her birth. We knew that her heart had stopped, and went to the hospital to be induced and have this baby that I knew was not going to be alive. Well, during that process, I had an amazing nurse who took such great care of me and my family, emotionally, spiritually, physically, every way possible. And I knew then that that was what I wanted to do with my life. I wanted to make a difference in somebody else's life the way that she had made a difference in mine. It was not an ideal time. I could not be in school at that point, but I knew that that was what I was going to do. So as time passed, I did apply to a nursing program at the local technical college. I had all my prereqs in order. I took those along the way. Also, my name came up on the list a couple times because there was a pretty big wait, and I had to pass it up. It just wasn't the right time. I knew I had to wait until it was right for my family, my children, my husband, and myself, so that I could give 100% of myself to what I was doing. So once I entered the program, I graduated in December of 2009. I immediately started the process to work towards my BSN, and there was no better place to go but to JSU, where it all began. I felt like for me, that was going to be the culmination of full circle. That's where I had started when I was young, and to get my bachelor's degree from there would mean a whole lot. My brother and sister also both have degrees from JSU as well. So this is my only visual aid, but I have my degree from Jacksonville State. Along the way, as far as my career, I started out in a cardiac intensive care unit at the local hospital, and I loved every minute of it. I had great mentors, I had great preceptors, I had the best nurses to learn from, and I enjoyed everything I did. I loved it. I also did hospice on the side just as a PRN, just because that's something I knew I kind of always had an interest in and wanted to do, but needed a little bit more experience before I could jump in all the way. After about a little over a year and a half, we moved to another state, and I worked on a hospital at University Hospital in Augusta, Georgia, on a med-surg unit for a short time. And then I moved to a case management position where I did case management in a Medicaid waiver program, which was something I really enjoyed. Dealt a lot with the geriatric population for the most part. I also continued to do hospice. I did a lot of on-call on the weekends, which is the one thing in hospice I love the most. And finally, we ended up moving to where we are now. I live in Cumming, Georgia, and I'm currently employed at Peachtree Christian Hospice. We are a hospice inpatient unit. We're about 30 miles north of Atlanta, and I am the director of nursing / clinical director, or whatever title we choose to use, which means I do a little bit of everything. I find that the thing I enjoy most about my job is when I get a chance to get back into the clinical aspect of patient and family care. I enjoy the education with the families and the patients regarding hospice philosophy, the services we provide, going over the consents, talking about the goals for the patient and the family for end of life. It's not always an easy conversation, but at the facility I'm at, it's generally a must-have conversation for most of our patients, because most of them are approaching the very end of life. I love hospice. I'm actually a certified hospice and palliative care nurse. That's a certification that I take a great amount of pride in, and to be considered an expert in the field, which I never say I'm an expert in anything, but hospice is the one thing that I do know and enjoy doing. I have, over the past several months, sat to discuss what do I really want to do with my future, and I just had a conversation with a friend of mine at work who works under me, and I was encouraging her that she should reach her goals and go ahead and start her BSN program. I had been putting my education on hold for so long. It's always I'm going to do it again, I'm going to do it, but I never really had a timeline. Well, I decided last Thursday that I would get on and look at the programs, and I decided, you know what, there's no time like the present. So here I am. Was very excited, as I said, to find that JSU has this NP program. My individual beliefs are, in regards to patient care, is caring for the whole patient. You can't just treat a disease, you can't just treat what's going on right now, but you have to treat the whole patient, because so many times their socioeconomic status or their psychological status or their family situations, whatever it might be, even finances, can affect the health. I think we've learned that, stress, whatever it might be, poor nutrition, all those things contribute to health issues. And so it's always my goal to know the patient as a whole, and that's what kind of helps us to focus on what can we do to meet that patient where he or she is. I know that doctors are great, and they're taught to diagnose and cure, and I think that's great, and I've worked with some amazing physicians, and I appreciate their stand. But I think we as nurses are taught to care and to nurture, and that's who I am. In fact, my caring model is what my idea of practice is, focusing on everybody and everything involved to provide the best quality of life, the best plan of care, whatever it is. What is that patient's goals? What are the family's goals? What can we do to make them more comfortable so that they can live out the rest of their life? And I don't mean just in hospice, but I mean as far as what can we do to fix this, but not put a band-aid, but maybe find out what we can do to help the whole patient and the whole family to make this the best situation possible for everyone involved. And that's my goal. I really want to get back into the clinical care aspect of patient care. I'm reminded that that's why I became a nurse. A lot of my job right now involves paper pushing, emails, education, which I enjoy, overseeing our nurses, educating them on new evidence-based practices, new protocols, new changes within our organization. But my goal is to be able to take care of the patients and the nurses that I work with as well. I have not been involved in any major creative or artistic endeavors because creativity is not one of my high points. I'm very type A personality. I'm very focused. I'm very much directed to do what I need to do. I always say that one of my greatest skills is that I can wing it in just about any situation, as that is something that is necessary in hospice. I am looking forward to the opportunity to reach out of the hospice guidelines and step into the world of just healthcare in general. and the geriatric population is something that I'm more familiar with my experience, and is something that I'm really interested in pursuing. I do develop monthly meetings with each of our staff teams, the day and the night shift. I do education. I have to do assessments on evaluations, all those various things as expected as a manager, which is something that I do enjoy. My experience is broad, I believe. I've worked my way from preceptor to charge nurse to now a director of clinical services, and now I'm looking to be a nurse practitioner and be an integral part of the team, both within the healthcare facility as well as within the family for the patients that I choose to serve. And so I would ask that you consider me for this program, and know that I will give 155% of every part of my being to be successful, because I treat every patient as if they were my own family member. I most recently had my own health situation in which I was in the hospital for several weeks. It just came out of nowhere, and that became the defining moment for me as far as patient care, because I say when I was on the other side of the bed, I learned so much more about health care, being an advocate for yourself or for your patients, and it taught me more than any clinical experience or any book or anything else I could have done. And as difficult as it was, I'm very grateful and appreciative, and I feel that that will shape me as a nurse practitioner. So again, I thank you for your time, and I thank you for the opportunity to apply for this program, and I look very much forward to hearing from you in hopes that I can be a part of this inaugural class at Jacksonville State University. Thanks so much, and have a great day.